Hello everyone, welcome back to my YouTube channel. If you don't know me, I'm Ashrafology and I make content for medical students, doctors, and everyone in general. I recently sat for the USMLE Step 2 clinical knowledge exam and I scored a 267. Now, a lot of you guys have been asking me before my score how to prepare for the exam, what resources to use, all these other questions about the nitpicky details of where to do a certain subject from. And I didn't feel comfortable answering those questions because I hadn't sat for the exam in the first place. But now that I've sat for the exam and I realize what I've done right, what I did wrong, things that I believe you should not do or should do when preparing for this exam, I feel like I'm in a much better position to comment on how to prepare for the USMLE Step 2 clinical knowledge exam. So just like in all my other videos, I don't like prolonged intros and just wasting your time. We're just going to start this video immediately. All I can ask you to do is, if you like my videos, please do subscribe, like, and comment any questions that you have. So without further ado, let's start. First of all, how to prepare for the USMLE Step 2 clinical knowledge exam. So here's how you're going to start. You're going to build a base. That base is going to be built by UWorld. Everyone tells you to do UWorld, and I'm not going to reiterate what millions of others have said on the internet, that you have to do the explanations, read the things that you got wrong, move on if you know it completely. We're not going to, talk about that because it's been talked about ad nauseum before. The way I would approach UWorld is a little bit different. You're going to do UWorld in random, untimed blocks, including all the systems except ethics and biostatistics. Now, you're going to do that for the first 30%. You have to focus on building a foundation. After 30%, the concepts, the topics that you will see, they're mostly going to be things that you've seen before, with a few, obviously, new topics that you haven't seen before. But beyond 30%, you're going to start working on your test taking skills. For example, I did UWorld from 0 to 30%, included all the systems except ethics and biostats, and I've reached the 30% mark. Now, when I do the random time blocks, I'm not really going to be focusing on the explanations. My perspective is going to shift. I'm not going to be focusing on content. I'm going to be focusing on my test taking strategies. For example, you encounter a question of some trauma patient and you don't know if it's hemothorax or pneumothorax. You're going to see the subtle differences that make you confused. For example, hemothorax would have flat neck veins and pneumothorax would have distended neck veins. Sometimes it comes down to that tiny bit of a detail with you getting that answer right or wrong. And that really is how the USMLE is designed. It wants you to notice subtle differences in diseases that present very similarly, but it wants you to differentiate between them. So from the 30% mark onwards, you're going to focus on your test taking strategies. How you're going to focus on that? Well, what you're going to do is, if you got a question right, if you got a question wrong, you're going to see what was your kind of thinking process during that question. What were you thinking? What did you notice in that question that made you choose that option? For example, I chose distended neck veins, it's pneumothorax. I based my answer on that detail. What else was in the stem? Hypoxia, a history of trauma. What else was in that stem that made you choose that option? Vice versa, if you got it wrong, you're going to see what would have made your answer, the one that you selected but got wrong, right. And you're going to see what makes the right answer right. What detail makes the answer what it is. Obviously, if you've never read a topic, you don't know what it is, you're going to get it wrong. But that's why I focus on the approach in which you're going to focus on your content for the first 30% of UWorld. Afterwards, you're going to focus on test taking strategy. I'll be making a whole series of videos on how to improve your test taking strategy, but now we're just here to talk about USMLE Step 2 preparation. After you've done around 87, 88% of UWorld, you'll be left with just ethics and biostats. You're going to do 10 questions of ethics and biostats every day for the rest of your preparation period. Why? Because ethics and biostats it's a little bit bland. You can't just do it in one setting and call it a day. It's like learning the piano. You have to give it 10 minutes every day. When you hit that 88% mark and you're doing 10 questions of ethics and biostats every day, you're going to shift your perspective. Now is the time that you have to stop UWorld. Okay. And I'm really emphasizing this. Why? Because the actual paper and the actual way the questions are asked, they're not like UWorld. UWorld basically gives you a very nasty habit of you overthinking every question. You thinking that this question isn't that easy, there's some twist to it. The actual exam is not like that. The actual exam focuses on classic presentations with one minor inconsistency, but the answer is still going to be what 70% of the question stem was. And how can you change your test taking approach from that of the UWorld to that of the USMLE test makers? That middleman is called CMS forms. So when you're done with UWorld and you're doing 10 questions of ethics and biostats every day, you're going to shift to CMS forms. Please do not start NBMEs without completing CMS forms. I've seen people with great self-assessment scores not perform on the actual day because they haven't focused on what the test takers are asking, how they're testing you. Okay, so that is like 50% of your preparation is content, 50% of your preparation is test taking strategies. You're going to complete all CMS forms. There's a lot of them. There's 3 CMS forms for emergency medicine, 3 for family medicine, 4 for medicine, 4 for surgery. The list goes on and on. I'm afraid you're going to have to complete all of them. When you've done UWorld, when you've done CMS forms, you write your first NBME. Now, the sequence in which you write NBME, I believe, matters a lot. Some NBMEs are absolute soul crushers and they will destroy your morale if you do them nearer to your exam. So after you've done all of the above, you're going to start off by giving a baseline NBME, and that's going to be NBME 9. Okay, NBME 9 is relatively outdated. It's still not retired. The form is still there on the official NBME website, but you still have to, you still have to do it. Now, there comes a debate on whether to buy NBME forms or do them offline. And my 2 cents on this is if you can, please buy the online forms. I bought them. They were very expensive, but they give you a very accurate representation of what you're weak in, what you're strong in, and what you need to improve. They're really good at doing that. For example, I noted that I was consistently losing marks in endocrinology and female reproductive system in obs and gynae. It's a difficult system. And then I decided I can't lose any more marks here. So what I did was I bought a 1-month AMBOSS subscription and I did all of the questions of endocrinology, female reproductive, and obs and gynae from there. And lo and behold, my scores improved. That's something you can't do with the offline NBMEs. You can dissect each and every question you got wrong, see which system it's from, and focus on that system. It's just a lot of time spent on something that the online forms already give you. So that is something, it's up to debate. If you want to do the offline forms, I'm not going to recommend it. People ask me, can we do the offline forms? I don't recommend it. I completely recommend buying the online forms if you can. But that's just me. Now, when it comes to NBME scores, you have to take everything with a pinch of salt. The NBME curve, the NBME practice exam curve is very harsh. It's much harsher than the actual exam. For example, you only have a margin of like 23 if you want to score above a 270. Same goes for 250. If you want a score of 240, it's like 48 mistakes. things like that. You have to understand that one self-assessment score does not define you, whether it's good or it's bad. And why I say this is so important. Now, everything that I've described is things that you're going to do because these are the mistakes that I've made. And I'll tell you how my journey started off when I did my UWorld. I was doing my ethics and biostats. I had not done the CMS forms, unfortunately. So I gave my first NBME. Um, I gave NBME 12, I believe. It's known to be very tough and very underpredictive. And I got a 261 in that. I was very, I was very happy. I was like, I got a 261 on the most underpredictive form. I then gave the UWSA 1, which is also known to be very underpredictive. I got a 263 on that. I was so happy. I was like, I can just give this exam tomorrow. However, my confidence really got shattered very quickly when I gave NBME 9, 10, 11, and 13, in which I consistently got 240, 245, 247, 249, 245. I was not even crossing 250. I was like, what is wrong? How could I score so well on assessments that are so known to be difficult? And I'm not even crossing 250s on the other self-assessment forms. I stopped for a second. I was like, I'm not wasting NBME 14 before I fix what's going on. And that is when my friend asked me, have you done your CMS forms? I was like, yeah, I did one or two. He's like, do all of them. I spent like 5 or 6 days grinding CMS forms, just completing one system after another. And during that time in my CMS forms, whether consciously or subconsciously, my test taking strategy changed. Previously, I was very used to attempting questions based on the UWorld approach. They give you 90% something else, 10% of a detail will change the whole answer. That's not how the NBME works. It's the exact opposite. It's 90% actual answer and 10% very minor inconsistency. Like I said before, I'll be making a whole separate video series on test taking strategies and how to improve your NBME scores. If you find out that you're consistently studying so hard and your NBME scores aren't improving, that means you don't have a knowledge problem. The problem lies with your test taking strategy. I fixed my test taking strategies. I gave all the CMS forms. I focused on simple things. For example, right upper quadrant pain. I'm not going to think choledochal cyst as my first differential. I'm going to think acute cholecystitis. Occam's razor, horses, not zebras. So please don't think you're special, because that was something that happened to me, that I was so obsessed with diagnosing the top 10% of rare conditions that I was neglecting the 90% of common conditions that you will encounter in clinical practice. So please don't do that. That doesn't help. You'll have plenty of time when you're a doctor in the United States to diagnose rare conditions or difficult conditions, but please focus on the common conditions for now. So I fixed my test taking approach. I gave NBME 14 and my score improved. I got a 255, I think. I was very happy. I was like, thank God. Previously, I came this close to canceling my paper because I was like, I'm not improving. And you're not improving not because you don't have the knowledge, it's because you aren't attempting the question properly. So please, if you notice this pattern, fix it before you waste an NBME. So now I was left with just 20 days and I had NBME 15, 16, UWSA 2, and free 120 left. So I divided each self-assessment at an interval of 5 days. And during that time, I focused on ethics, quality improvement, and patient safety. There is no other resource for this other than AMBOSS. AMBOSS blows every other resource out of the water for this particular topic. Their articles, their questions, sublime, absolutely amazing. The concepts that they've written and the questions that they've asked are really representative of things that you might see on the actual NBMEs or test day. So here's how I would recommend focusing on the last leg of your journey. I still had a self-assessment every 5 days. I was still focusing on ethics, patient safety, quality improvement during those last couple of days. But during that time, because I still had the AMBOSS subscription, I did all of the AMBOSS high yield plans. These are so good, and I really don't understand why these aren't talked about more. It's such a nice, concise summary of everything that you've learned throughout your UWorld, CMS, NBMEs. And it's consolidated in such a way that you learn so much from doing just one question and reading all the options. So I did the AMBOSS high yield plan for risk factors, from patient chart questions, for biostatistics, for patient safety, quality improvement, 30 concepts that appear on every step 2 exam. Basically anything that touched step 2, I did it. And I am telling you, this is such a slept on resource during your last 10 or 15 days of preparation. And I feel like it should be talked about more, and I'm going to use my platform to talk about it. I wish UWorld or AMBOSS would sponsor me in some way, but unfortunately that hasn't happened. Otherwise, I would have given you an ambassador code by now. But I am going to talk about how good of a resource AMBOSS is in certain areas. Like your weak areas, I wouldn't feel the need to go back to UWorld because you know the questions, you've memorized them. It's not new material. You need to jump to another resource. That is when I used AMBOSS for topics that I was weak in, or the high yield plans, or ethics and patient safety and quality improvement. Absolutely clutch. Now, there are a few other resources that are talked about, and I would like to take a few minutes to talk about them. Divine intervention, I couldn't vibe with it. I couldn't vibe with divine intervention, to be honest. Um, then Mehelman's, I might have used him for step 1, but not for step 2. Um, I didn't think twice about using him for step 2. It's just, there's so many resources for step 2, and believe me, completing them is a journey on its own. I'm not going to grab another resource. Finally, some people say that they, did a second pass of UWorld, a second pass of CMS forms. I don't think it's worth it. Things that you've seen once, no matter how much we think we've forgotten them, our subconscious remembers them in such a way. If you see a question that you've done before, but you've forgotten it, and you feel like this option is right, that's not a sign from the gods that you're being bestowed by the answer. That's your subconscious telling you that the answer is this. um, and that's basically how the preparation works as well. Your subconscious tells you what the presentation looks like, what the buzzword is, what the imaging looks like. So I would prime my subconscious with new material rather than old material. I just don't think it's worth it doing a second pass of UWorld or CMS forms. People do it. I don't think it's worth the time and effort. But again, what I say is, it's subjective. It could really work out well for you. Regarding my scores, I did the NBME 15 and 16. I think I got a 260 plus on both of them. And my free 120 was 80%. And my UWSA 2, I saved for the very last because I heard it is the most predictive self-assessment. And that is very true. I gave it as the last self-assessment, and I got a 266, I think. And my actual exam was 267. So it is the most predictive self-assessment. I wouldn't recommend taking the UWSA 2 as your first or initial self-assessment because there are a lot of concepts that you learn throughout your NBME CMS journey that will be tested on UWSA 2. So please don't do that. Save UWSA 2 for last. The test itself is absolutely brutal. I'm just going to be very sarcastic right now. The break time is so limited that literally I wish I could have peed while getting up from the chair so that I didn't have to go to the washroom and, waste my break time. That's how limited the break time was. I'm like literally exaggerating it. But I was so pressed for time. I literally had to do one block earlier than the rest of my blocks because I did not have break time. So please manage your breaks properly. When you get out of the exam, you will feel absolutely horrible. That is a universal experience. No one or hardly anyone comes out from the paper saying that they crushed it. It was amazing. I knew every single question. No one says that. Everyone comes out almost devastated from the paper. Whether you're a gunner, whether you had below average scores, whether you had average scores, everyone comes out absolutely traumatized from those 9 hours of torture. The next 2 weeks are going to be absolutely brutal because you're going to keep on thinking, what did I do wrong? What was I thinking? You're going to make silly mistakes. You're going to get easy stuff wrong. But I feel like the NBME takes these things into account. They know everyone's going to screw up just a little bit. And I feel like they take that into account. Last piece of advice I would like to give you is please try to give your exam within your trial period. Don't go on extending it again and again. It's a vicious loop of we don't think we're going to get enough score. We're going to extend our triad. Your scores are not improving. Extend the triad. Scores are not improving. Extend the triad. And it's a lot of dollars wasted. So take your time in selecting a triad when you are comfortable with your preparation. Okay. And just give yourself a pat on the back for even walking into the exam. My friend used to say walking into the USMLE Step 2 exam is half the battle won. And that is literally what it feels like. And that's all from my side. I will be uploading videos on NBME test taking strategies. I will be doing a whole series on ethics, patient safety, and quality improvement because I prepared them very well and I really want to impart my knowledge to you guys before I forget the concepts. So stay tuned for that. Please like, share this video with your friends who are preparing for the exam, comment any questions you have, and I'll see you in the next one. Bye-bye.